Hello, my name is Rosa Centeno, a student of the Faculty of Medical Science of the Nursing Garden. Definition: prolactin, a pituitary hormone, performs various functions in vertebrates and non-functions in humans are in the process of lactation and reproduction. A loss of function variant in the hen containing the prolactin receptor has been reported in a problem with persistent postpartum galactorrhea and hyperprolactinemia.
Prolactin hormone test. This test is performed to help investigate unexplained flow of breast milk, abnormal nipple discharge, absence of menstrual periods, or infertility in women. In men, to help diagnose the cause of decreased libido or erectile dysfunction, and to detect and monitor a pituitary tumor that produces prolactin. The sample required is a blood sample drawn from a vein. Prolactin is produced by the front portion, anterior, of the pituitary gland. It is normally low in men and non-pregnant women, as its primary role is to promote breast milk production, lactation. It is normally elevated in women during pregnancy and just after childbirth, as it helps initiate and maintain the breast milk supply. If a woman does not breastfeed, her prolactin level soon drops back to pre-pregnancy levels. If she does nurse, suckling by the infant plays an important role in the release of prolactin. When a person has a tumor that produces prolactin, this test may be ordered periodically to monitor tumor growth and its response to treatment. They may also be ordered at regular intervals to monitor for tumor recurrence. Many factors may moderately increase or decrease prolactin levels, such as certain medications, stress from illness, chest wall trauma, seizures, and lung cancer. Al Borg Medical Laboratories. Watch more at our YouTube channel.
Application: the basic goals of treatment in patients with prolactinoma include 1. Decrease in hormonal secretion with normalization of serum PRL and its clinical translation with special emphasis on the restoration of gonadal function. 2. Decrease in stomach cysts with improvement in neurological symptoms. 3. Preservation of residual pituitary function or restoration of hormonal deficit. 4. Prevention of tumor progression or recurrence.
Hello, I'm Dr. Nupur Sood. I'm an obstetrician, gynecologist and a gynec laparoscopic surgeon. I have been practicing for the last 12 years and at present I am heading the Department of Gynecology at Narayana Hospital, HSR. So prolactin is basically another hormone which is produced by the pituitary gland, and the higher levels of these prolactin also inhibit the ovulation from occurring properly. So this can be checked with a simple blood investigation. Just like how thyroid levels are checked in a morning fasting sample, similarly the prolactin also can be done. Clinically, usually the problem would be that your periods are a little delayed and then the flow during the periods is reduced. Some do complain of occasional headaches when it's a very high levels of prolactin, and people do come back when they're saying they're not conceiving and we do these hormone tests for them. Now any level more than 30 in the prolactin is requiring treatment, and then the dosing pattern is decided based on that. And once you conceive, then these medications are stopped. Usually we get a very good response if this is diagnosed and treated on time.
Pros and cons. Pros: not all women with hyperprolactinemia need treatment, though women with hyperprolactinemia who do not produce estrogen. As a result, need a treatment that causes here the production of provide estrogen. Might not be needed treatment if no cause has been found or if the elevated level of prolactin is due to a small tumor in the pituitary gland and still does the patient produce estrogen. Cons. In men, elevated prolactin level can cause gonorrhea, impotence, reduces sexual desire, and the infertility. A man who does not treat his hyperlatinemia might produce less or no sperm at heart. Issue appears in Ecuador. Its prevalence is approximately 500 cases per million inhabitants, and its incidence is 27 cases per million per year. Its main complications include osteoporosis, complications associated with pregnancy, reduced level of their pituitary hormones, and loss of vision. The objective of this study is capturing the hierarchy relative to the diagnosis and basic treatment of prolactinoma. Conclusion. In patients with hyperlatinemia, its approach must be done in an orderly, comprehensive, section and detailed manner in order to rule out prior to treatment situations that secondary rise prolactin values. Thank you.